Terry had a unique, really very bad experience of involving the trauma. And actually, his girlfriend, right? You shot this video there. I'm sorry, your name. I always saw you. Morgan, yeah. Morgan shot the video. Terry was. Can you describe what that sport? I don't even know what the name of.
It's not a sport. It's just
not a sport.
A dumb activity we came up with.
Dumb activity.
Yes, yes, sir. We were on an inner tube pulled by a rope, and the rope was tied to a bungee cord. And in the lake was a jet ski, and on the ramp, the jet ski was supposed to pull off, and we were supposed to catch air and land in the lake. And there was people behind us holding the inner tube, and they held too long, and the bungee cord snapped, and it hit me in my face. Broke multiple bones. I had to have reconstructive surgery on my face. I lost vision in my left eye, and I developed a rapid cataract in my right.
He lost his all the sight. I mean, right now you have a prosthesis right now, right?
Yes, sir.
Yeah. He entirely lost his eyeball. I mean, he has to have enucleation, removal of the eyeball itself. I mean, at age 19, you can think about it. It's very traumatic. And so Terry came with his whole family, and we had a long talk. You know, I'm going to stand here so we can do the video. We had a long talk. You know, this eye's gone, and this guy is rapidly developing cataracts over the course of a few months, 3 or 4 months, to a point that if it got any worse, cataract in this only remaining eye, that nobody will even dare to go in there. Because when cataracts get really bad, the risk of surgery is higher. Now, you were evaluated by a doctor at Vanderbilt.
Yes, sir.
Yes. And the doctor said, don't touch it.
She didn't want to touch it.
Yeah. Because it's only one eye. You only one shot. And can you imagine at 19 years old, if you lose the other eye, then his entire life is shot. The doctor worried at Vanderbilt was good for good reason. Because even though the bungee cord hit the inner tube, hit the left eye, he ended up losing the entire eyeball. But the impact of the injury is so bad that it caused cataract in the other eye, rapidly over a few months. So if one is going to do surgery, you open the eye, there's a risk something was shaking up and the whole lens can fall back. Then you can have retinal detachment, capsular back break, infection, blindness. So that's why the doctor advised, not to have anything down there. But the problem is, it's catch-22. If you don't do it, then he's going to get worse in the next month or two. He's going to be totally blind. Then what you do? Then the surgery was even more risky. And we had a long talk, and I gone through all the risks and what could happen. 10 different things, wrong things could happen during surgery. If any of those 10 steps, bad things happen, he could be blind. And so we would pray together. Remember, at the room,
yes, sir.
Yeah, the whole family. We prayed together, and I want Terry to go home and think about it with the family. You know how God communicates with us. If it's the right thing to do, you will feel right. You know what I'm saying? And I don't want him to make a decision, because we have to live with the decision. Remember, 10 things can go wrong during the surgery. So if any 1 or 10 things go wrong, then he will be blind, and he and I will have to live with that decision of operating. So maybe you can describe what happened to surgery.
Well, we were thinking about it, and I called them to ask to set up an appointment, because when I heard about you, I never met you before, so I wanted to just meet you to see like the whole experience. And we called up there, and turns out that they got me in 2 days after I called, and we were expecting for my surgery to be a month after I called, and turns out he said that he was going to move patients around just for me because I was the main priority because of my condition. And he did it a week after we met, and the surgery went perfect. And I was really nervous. I was scared about it, and I didn't feel any pain. I recommend it, and I see 20/20 now.
And I want to say a little bit more about what happened during surgery. We prayed about it before the surgery began again. And I gone through in my mind there's 10 different steps, and knowing in each step it could be good or bad. You know, the only way he can survive the surgery and doing well is each of the 10 events, every time, good and bad, has to be good. Next step, good and bad, has to be good. You know, the chance of 10 steps, each step has to turn on the right way, not the wrong way, 10 times in a row. The chance is about 1 in 10,000. So, you know, it's
I didn't know that.
Yeah, you didn't know. I mean, we did not really know the extent of it before even opening the eye either, you know. But during the surgery was risky because I opened the eye, the cataract was getting very hard already. And I also saw why it caused the impact this way is because this inner tube hit so hard that the lens got shaken loose a little bit. So you have to put the lens inside that shaken loosing bag. But Terry was not very comfortable during surgery, but you were good.
Yes, sir.
He was he held very steady. And but long story short, God blessed us with a good outcome. I just saw him last week, 2020. We brought all the staff in. Everybody has saw the video that Morgan took. You know, and so Terry knows not to do that again.
Yes, sir. Thank you.
You're welcome.